Hello, my name is Gilberto Hernandez Castro. I am 17 years old and I'm from Prepatec Esmeralda. Well, in this video, I am going to talk about the HIV. Well, the human immunodeficiency virus. This infection is acquired through sex. This carries significant morbidity and mortality, especially in young people. With proper prevention, adolescents can determine their future about these epidemic problems by adopting sexual behaviors in a responsible way. Well, for this, they survey a sample of 240 grade adolescents from the Institute Vocational High School of Exact Sciences, Karl Marx, from Matanzas. Statistical analysis was performed using the StatCalc, that is a program of EpiInfo. Knowledge and attitudes were compared before and after the intervention. Well, the female sex with ages between 15 and 16 years old predominates. Little bit more than half of students frequently have sex at a middle age, so only 2/3 use the condom permanently. They didn't know the difference between safe sex and protect sex, so the mass media were the main sources of information. They had difficulties in differentiating the carrier from the patient, as well as the time of the take the HIV test. Well, the attitude towards the disease is valued as a positive and demonstrate the influence of peers to make decisions. An increase in knowledge about HIV, but dissonance with sexual behavior indicates a continuing need for educational work. Well, the acquired immune deficiency syndrome, AIDS is a chronic disease. It's a communicable virus caused by the HIV, the human immunodeficiency virus, as I already mentioned. So, they are a set of symptoms and signs caused by the weakening of the immune system that favors the appearance of opportunistic infection or fatal tumors. Well, sexual practice, as I already mentioned, again, is the main route of transmission. Then its prevention depends on the responsible behavior of the individual and of the modification of their habits and behavior. The epidemic fundamentally affects young people, considered by UNESCO as one of the four vulnerable groups for acquired diseases. Well, the non responsible sexual behavior you will suffer. Adolescents depend on attitudes passed down from generation to generation and know of knowledge about the HIV. So the educational complications they should be directed towards that group when they have not yet started sexual relationships and can work to achieve changes in attitudes. As the educational level increases, adolescents are less precocious in starting specific behaviors and link affectivity more to sexuality. The, the future of the HIV epidemic is in the hands of youth because the behaviors that adopt now and those who remain throughout your sex life will determine your evolution in the coming decades and may be a determining factor in its control. For this reason, people decided to implement an educational intervention on HIV and AIDS in adolescents, with a description of the characteristics of the adolescents in the study according to variables and those identified and compare the knowledge, attitudes, and practice related to the HIV/AIDS before and after this educational intervention. Well, now I am going to talk about the history, the beginning of this HIV infection. Well, this infection, this virus was characterized by the effects of an incurable disease, fear, stigma, and death. However, the discovery of virus and transmission routes The development of diagnostic methods and the appearance of the first drugs, antiretrovirals, contributed to partially control the infection and to achieve progressive awareness social. Well, then, the development of highly effective drugs in the mid-decade of 1990s allowed the control of the virus in infected people and progressively the life expectancy of people living with HIV are currently approaching the of people without HIV. Well, the first cases of HIV infection in humans were, well, they occurred around 1920s, something like that, in Africa, in the Democratic Republic of Congo, due to the jump between species of a similar virus that infects chimpanzees. Available data suggests that the current epidemic, which it ended up spreading all over the world, it started in the mid-1970s. In September 1982, the term AIDS, acquired immune deficiency syndrome, was determined for the first time. Then, in January 1983, the CDC reported on cases in female sexual partners of men with AIDS, and in September of the same year, 1983, the main routes have already been identified of the HIV transmission. Well, then in 1988, the WHO, the World Health Organization, declares December 1st as World AIDS Day, which is celebrated that year for the first time. In 1990, after 10 years of epidemic, it was calculated that in all the world live between 8 and 10 million people. That's an enormous number. With, well, these people that have this virus, the HIV, so it had cost around 330,000 deaths just that year, the same year. It's a lot of people. So in 1997, the first combination of two drugs in a single tablet was approved. So that was awesome for the world. Then in 2006, it was observed for the first time that deaths have reduced worldwide. Then in 2012, the first self-test was approved in USA of HIV that will allow users to know their status immediately. In 2015, the World Health Organization, WHO, launches new measures on the treatment that they have mentioned. Despite advances in prevention and treatment, the HIV remains a major public health problem around the world. After having collected more than 34 million lives until 2015 worldwide. Well, now I'm going to talk about the virus and the infection. I ask you a question. Well, what is immunity? Immunity refers to a system of a very complex defense that is also known as the immune system or immune system. And this was made up for a group of cells and substances produced by the body whose function is to face the invasion of any foreign agent that enters to our body. They can be germs, viruses, bacteria, parasites, etc. or toxic to prevent it from spreading the organism. A virus is an infectious agent that can only multiply within the cells of other organisms. HIV is an RNA virus. Viral load analysis consists in measuring the number of copies of HIV virus, RNA, in a specific amount of blood, reported as number of copies of HIV per millimeter of blood. Then HIV infection and AIDS Once HIV infection has occurred, there is a battle between the immune system that tries to eliminate this infection and the virus that attacks and destroys CD4 lymphocytes. After a variable time since infection, between a few months and more than 10 years during which the person with HIV may not manifest no symptoms of this disease, this virus, ends up winning the battle and different infectious diseases appear, such as oral candidiasis, tuberculosis, pneumonia, and diarrhea, and also cancers, lymphomas, or others, associated with the serious deterioration of the immune system. Immune defense system. AIDS is the set of clinical manifestations derived from the loss of defense capacity or immunodeficiency in our body, secondary to infection by HIV, and is the final expression of the disease. However, not just any disease in a person with HIV indicates you have AIDS. Within the classification made CDC established 3 clinical categories of people with HIV that are Category A, or category number 1, is that patients with primary infection or asymptomatic. Then category B, or number 2, are patients who present or have presented symptoms that do not belong to category C, but that are related to HIV infection. And the last one, the category C, or number 3, are the patients who presented or have presented some complications included in the definition of AIDS WHO in 1988. Where we can take the test? Well, the HIV test diagnosis can only be established by laboratory test by means of a blood or saliva test. The fastest test can get results in less than 3 minutes. The proof it is voluntary and confidential. The test can be performed through the primary care physician, in health centers, in prevention of sexually transmitted infections, or also in some pharmacies and NGOs. If the result is negative, the result shows that the virus and antibodies against the virus are not detected in your blood or in your saliva or something else. However, if you have had a recent risk exposure, the negative result doesn't rule out completely the possibility of HIV infection, because you can be in the so-called window period during which virus is not detected in the blood, despite having acquired. And if the test result is positive, it's necessary to carry out some additional analysis and continue the study to confirm the result and decide to start antiretroviral treatment. It is important that you go as soon as possible to the doctor, even if you don't feel bad or you don't have any symptoms, so they can inform you, they can tell you the steps to follow. Then antiretroviral treatment manages to maintain undetectable virus, increases defenses, improves quality of life, and decreases the possibility of transmission of infection to other people. Well, how is the virus transmitted? It can be transmitted by blood, semen, vaginal secretions, milk of people when they are babies with HIV that contains high amounts of these small viruses. So transmission can occur when the virus contained in these liquids reaches the blood of another person through wounds or skin pricks, or when any of these fluids comes into direct contact with body mucosa, vaginal, anal, or oral, even if they don't have wounds. In a sexual way, transmission occurs by having penetrative sex, anal, vaginal, or oral.